We're going to go back to the phones. Kobina, you're on the air.
Hi, good evening.
Good evening.
It was so ironic. Only yesterday I had the opportunity of consulting with a plastic surgeon on 4 zones, my chest and love handle areas. And 2 questions I've got. For skin that may keloid, I mean, how do we prevent that in this case? And also the cost associated with getting it done. I mean, I know private insurance wouldn't cover, or maybe they do cover something like this. What is the cost of removal or getting this done?
Okay, and we were talking about that in the break, Dr. Zubowski. Not most insurance plans cover it. It covers it for a specific condition that men have called gynecomastia. And explain what gynecomastia is and what the cost is.
Well, gynecomastia is the abnormal growth of breast tissue in a male. We all have breast tissue, and in some of us it can grow to a larger degree, and in those situations the breast can be made up of a combination of fat and breast tissue. Regardless of what the combination is, once you have that problem, it can often be a covered procedure by the insurance companies for its removal. Liposuction, specifically ultrasonic liposuction, is very good at removing that tissue. In the past, open incisions were necessary to remove breast tissue in men, and that has been minimized to a large degree by the use of ultrasonic liposuction. The cost of liposuction varies dramatically based on the number of areas that we're treating. I'd say it can range from a low end of $2,000 to $2,000 to $2,500, which includes professional fees, facility fees, anesthesia, to upwards of $10,000 or more if many areas are being treated.
So it's defined based on the number of zones, as Kobina talked about? Okay. Right. Let's go back to the phone. Sandy, you're on the air.
Hi, I had liposuction about a year ago, and I've noticed since then my skin has sort of like a lumpiness or a pocketing and an unevenness in my skin, not my skin tone, but in the buttock regions. One side hangs down a little bit lower, and it's uncomfortable when I walk. My doctor that I went to sort of just chalked this up to my own insecurities, or that I was, that I wasn't really seeing what I see. And I was wondering if this is common. I've noticed like pocketings in other people that had liposuction, and how common it is, and if it's possibly fixable, or is it just taking out the fat and contouring it, and then just whatever happens, happens.
And that is a good point. We showed a before and after, and I don't know if you have a before and after, but is this a common problem?
It's not a common problem, but it is a problem. In terms of local problems that we see, contour irregularities are one of the more common problems, and they really occur, or they can occur, when liposuction becomes superficial, when we start working very close to the skin. And there are some reasons that we may want to work close to the skin, but by and large, most liposuction areas are treated from deep to superficial. When we remain deep with liposuction, deep meaning in the most deep layers of fat away from the skin, we can avoid a lot of these contour irregularities.
Well, that's a really good point, because when you're looking at the skin and the different layers of skin, that fat's going to be down below a certain point of the connective tissue.
Right.
And you don't want to damage any of the connective tissue. You just want to pull out the fat.
That's right. Actually, the fat, the character of the fat and the quality is distinctly different just below the skin versus very deep below the skin. And what we want to do is address the fat very deep to get that bulk off. There are situations where we want to be just below the surface of the skin, and those situations are where we're trying to stimulate poor quality skin to redrape or to contract.
But go ahead.
For example, gynecomastia, we do want to be close to the surface of the skin to help stimulate that skin to redrape. But by and large, we're working away from the skin. So we can get into trouble, and we see these contour irregularities when suction becomes too superficial.
Excellent. Thank you very much, Sandy, for bringing that up. Tanya, you're on the air.
Hi, Dr. Willis.
Hi.
I'm 41 years old. I'm 5'3", and I weigh about 141 pounds.
Not too bad.
Yeah, but I can't get rid of the bottom part of my stomach. I exercise, I do crunches and leg lifts and everything, but it won't leave. It looks like a love handle at the bottom of my stomach. I did have one birth, and that was cesarean section. I've also had a ectopic pregnancy, which resulted in an operation on the same cut. And what I wanted to know is, did that damage my muscles, or is that considered to be poor skin tone?
You know, I just love our callers because you just bring up so many different dimensions, and this is another good call with regard to the nuances of selecting patients, the different criteria for liposuction. Please answer Tanya's question about that.
Well, you know, in terms of your height and your weight, you're certainly not overweight or terribly overweight. And, you know, it sounds like the skin quality is probably good, and the fat seems to be localized to one area. So it sounds like you're a good candidate for suction. I think the first thing we would do is assess the amount of fat versus the amount of laxity or weakness in that tissue below. And that would tell us whether or not we can achieve a flat contour by suctioning alone, or whether or not we have to do something to tighten up the muscles, like a tummy tuck. One of the first things we would do is simply, when we examine you, look at the quality of the skin, and then just pinch it. And we'll see the amount of fat that you have down there. If there's a significant thickness of fat, and we examine the muscles, and they are well toned, then liposuction is going to give you a great result. If, on the other hand, the muscle tone is very poor, you may need to have those muscles tightened as well.
Okay. Did we answer your question?
Yes, you did. Thank you very much.
You're so welcome. Joanne.
I have a question for the doctor.
Yes?
I just went for a consultation for liposuction about a month ago. I'm 5'5", 140 pounds, and I was turned away because he told me I needed to lose weight.
Wow. Now, let me just ask you you're 5'5" and 140?
Yes.
And that's it?
Yes.
And everything else was okay?
Everything else was okay. No sagging skin, no previous births, nothing like that.
Quickly answer her questions because we're coming up close to a break.
I'd call him again. Go back.
That's as quick as you can get it with regard to how do you find a surgeon? I mean, and we talked about that a little bit, but very quickly, where does a person go to find the right surgeon?
Either their local hospital they can call and get information on board-certified plastic surgeons, or the American Society of Plastic and Reconstructive Surgery. They can call and be referred to plastic surgeons who are qualified in their area.
And you know, when we're talking about finding that right doctor, if I come to you and okay, I'm a doctor, but I'm coming to you, I still need to have realistic expectations. What are the 5 things you want to get across to me as your patient?
Well, I want to know from you what your expectation is. What do you want to achieve? And what I'm going to relate to you is whether or not we can achieve it to your satisfaction. I want you to understand completely what the risks and complications are, so you are well educated and know what you're about to get into, and then educate you about what the recovery is like, so that you know how to plan your life after surgery.
And all of that is very important for you to know, and we'll have some final thoughts on liposuction coming right up after this short break, so please don't go away. We've had such great calls from our viewers about liposuction. What are the 3 things again that patients should know?
Board-certified plastic surgeon, realistic expectations, and a thorough knowledge of the risks and complications.
And when you know those sort of things for yourself and have those realistic expectations, know your body image, know what you want to get, control your lifestyle, because just having a procedure isn't going to change your life. It can if you change your lifestyle, and it all works together. Well, that's all the time we have today for our discussion on liposuction. I want to thank our guest, Dr. Robert Zubowski, from the Center for Plastic and Reconstructive Surgery at Paramus, New Jersey. And I thank all of you at home for watching. We'll see you next time on another edition of CN8 On Call. Stay well.